It was a shock to the entertainment world when Grammy Award-winning American Idol alum Mandisa suddenly passed away at the age of 47. Now, an autopsy later revealed she died from complications of class 3 obesity. Now, the gospel singer, well, she was very open about her struggles with her weight. Now, it's a familiar story for so many women, especially women of color. In fact, 80% of African-American women are considered overweight or obese. And joining us now to break this all down is Dr. Sue Decotiis. She's a medical weight loss specialist here in New York City. Thank you for joining us.
Nice to be back.
We were just speaking off camera. Are there different levels to obesity, and specifically, what is class 3?
Class 3 is when your BMI is over 40. So what is your BMI? That's like a standard measurement that insurance companies and doctors use, and it's basically your weight divided by height. So you can Google it and figure out how to do that. But there's also class 3, and there's class 2, and there's class 1, and there's also just being overweight. So when you're overweight, your BMI is between 25 and 30, and then class 1, 30 and 35, and so forth. But in my practice in New York City, what I really care about looking at is somebody's body fat. I want to look at their body composition. So we use a very particular scale, because you and I we could be the same height.
Right.
And be the same weight, and I can have a much higher body fat than you. Therefore, treatment will be different.
And it doesn't seem like BMI really takes into the fact that muscle weighs more than fat.
Exactly.
So let's talk a little bit about that. Is BMI even a great indicator?
Well, it's better than nothing.
Okay.
So in my practice, we use this body composition scale, and I treat many patients with Ozempic, semaglutide, Mounjaro, which is tirzepatide, Wegovy. So it's very important, if we're anticipating that this patient need medication, that we get a body composition reading. And that's how I follow the patient.
And it sounds like your body composition, the thing that you're doing, actually gives more of a better reading of obesity and overweight. Because I actually took the test, and before we got on the show, and it showed that I was overweight for my height and weight. So,
but you may not be. You might have more muscle.
Okay, and should there be other indicators actually added into that, genetics or your race?
Sure. I mean, if you're a brown or black person, it could be that you have more of a risk of obesity. But again, that's a generalization. That is not always true. When a patient comes in, I look at what is your lifestyle? What are your eating habits? But you'd be surprised how many people's eating habits are not as bad as you might think. Once you get to be a certain age, your hormones start changing.
There you go.
Your insulin doesn't work anymore. And that's how these drugs work. They don't just inhibit appetite. We're talking about tirzepatide, Mounjaro, Ozempic. These drugs work by enhancing satiety. They make you feel full, by slowing gastric emptying, but they also turn insulin on. So when your insulin starts working, you can burn fat effectively. Without that body composition scale, how do I know that this person is not losing muscle?
Now, you said class 3 obesity was a really high.
That used to be called morbidly obese.
Oh, wow.
We don't use that term anymore.
What are some of the complications related to that?
For everyone who's overweight and obese, obviously there's a lot of inflammation in the body, because fat cells make a lot of inflammatory factors that increase your risk for cancer, for abnormal gut flora. Many people that died of COVID were overweight or obese. Realize that. Obviously, diabetes and pre-diabetes, because that is basically end-stage insulin resistance, right? Also, cardiovascular disease, high blood pressure, increased risk of stroke, peripheral vascular disease, kidney disease, even kidney stones. And again, all sorts of immune diseases. Think about arthritis. Think of how many people in the United States need to get hip replacements, knee replacements due to obesity and all the stress on their joints.
And we want to also leave on a good note, doctor, because we know that you say your body composition test is more of a thorough indication of your weight and obesity. What are some lifestyle changes we can make?
Start moving. You know, if you're sitting around, for heaven's sakes, get up and move. Eat fresh food. Eat a lot of lean protein and vegetables. As many different types of vegetables as you can. Use herbs when you cook. Really get excited about your food. Stay away from processed food. Stay away from a lot of carbs. But if that doesn't work, come in and get evaluated. Because when your insulin isn't working, even if you're doing everything right, And another warning sign is people that used to be pretty lean, and these are women that maybe get into their late 30s, 40s, men around the same time. All of a sudden, you know, my body has changed. I'm doing everything I used to do, but I have a little belly now, and I just feel different. That has to be addressed. Just because those people are not necessarily obese by the BMI, it doesn't mean that they don't need to do something about it, because their body has changed.
All right. Well, Dr. Decotiis, thank you for joining us today.